medicine nowadays, we tend to segregate things. Sometimes we treat the heart and we don't think the consequences of that medication in other parts of the body. And it's not different when it comes to oral health. If you're someone who replaces brushing and flossing with mouth rinsing, with just a mouthwash, stop it right now. One area that's often forgotten is the tongue. Should I floss or brush first? Should we rinse our mouth after we brush our teeth? Is it all right to keep my toothbrush in the bathroom? Look, I'm not going to ask you to carry your toothbrush to the kitchen, but what I want you to do is, I'm Dr.Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Today I'm going to talk to you about something that I hear all the time from my patients. People ask me the most diverse types of questions. One of them is, why do we look into oral health holistically? The reason why I practice holistic dentistry is because we can't segregate the body. I can't just treat the mouth without thinking of my patient's heart, of my patient's lungs. We know that the bacteria that sit in the mouth travel a lot. They do take a ride on our bloodstream and go to other parts of the body. We also breathe a lot through our mouths, and we inhale a lot of bacteria when we're doing that. The materials that we use also have an impact on our body, so we are very mindful of that. I find very interesting how people segregate the medical field nowadays, and I guess it is quite important. We really need to have specialists in different fields, but we need to remember that we are treating one person, one body. So when we look at bacteria that we see in the mouth, we find the same bacteria in the brain, and it's been very closely related to Alzheimer's nowadays. We see a lot of research about that. And we see various other diseases. In fact, 57 diseases that have been related to bacteria that's found in the mouth. I'm not saying that they cause the disease, but if we have other factors there, we tend to see more disease in people with certain bacteria in the mouth. So that's the main reason why we treat people holistically. I want to make sure that what I'm providing to my patients is the best for them as a human, as a whole person, and not just by a set of teeth. So I really like having this discussion with everyone that comes my way. The second one that I hear very often is, I keep my toothbrush until I see that's really gone and the bristles are really flat or really going sideways like that. And I'm like, why do you do that? We're cleaning bacteria. We're cleaning plaque from our teeth. So the longer we leave it, the more bacteria we have brewing and growing on our toothbrush. So once the toothbrush is actually with not its original shape, it's time to have it replaced. The recommendation is 3 months, so every 3 months we should replace our toothbrushes. The other question that I get a lot is, should I go for a manual or an electric toothbrush? And in fact, it's whatever works in your hands. If you're brushing well with your manual toothbrush, you're using the right technique, go ahead and use your manual toothbrush. We see the research saying that the electric toothbrush removes more plaque. So when it comes to the great majority of people that I see, the population, we see on the research, we see that the electric toothbrush removes more plaque. On top of that, we have a little bit of collage information from the vibration of the electric toothbrush. So it's a very interesting point. For some people, I say, use the manual toothbrush during daytime, and at nighttime, before you go to bed, we really want to have most of that plaque not sitting on your mouth anymore, and so go ahead and use the electric one. So alternating is a good way to go. On the topic of the electric toothbrush, one thing that I hear from a lot of people that they really like about that is the fact that it comes with a timer. So most of them will have a timer where it buzzes after 2 minutes, and 2 minutes is the recommended time for brushing. Don't stay 2 minutes brushing on the same spot. Really, you need to create a sequence. What I say to my patients, start, let's say, from the top left, go all the way along to the top right, from the outside, the top parts of the teeth from the inside, and then do the same on the bottom teeth. One area that's often forgotten is the tongue. Yes, the tongue needs to be cleaned. It needs to be brushed. If we don't clean the tongue, we harvest bacteria on our tongue. The tongue has a very unique structure. It's a very, very unique texture. It's not like the cheek, the gums, the teeth. It's very velvety. It has that velvet where the bacteria sit, and then we need to clean that. So if we leave that, bacteria will overgrow, and then these bacteria are easily swallowed when we're eating or drinking anything. So make sure you're cleaning your tongue as well as your teeth and gums. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. Should we rinse after? Should we rinse our mouth after we brush or clean our teeth? In fact, the recommendation is to not rinse, because we want to use the good that's in our toothpaste. We still want to have some remaining of that in the mouth after brushing, so we can benefit from what's on the toothpaste that we have chosen to use. That's a habit that we have. We tend to rinse our mouths after brushing, but in fact, we don't want that. We want to spit out as much as we can, remove all the excess, and leave some toothpaste in the mouth. One of the main components of the toothpaste that we really want to take advantage of is hydroxyapatite. I know it's a complex name, a long word. Hydroxyapatite is been proven to really benefit our enamel more than fluoride. So fluoride comes with its downsides, whereas hydroxyapatite is 100% safe. We're going to talk more about that in another episode, but I just wanted to leave this super important hint for you here. One other question that I often get is it all right to keep my toothbrush in the bathroom? Yes, look, I'm not going to ask you to carry your toothbrush to the kitchen, but what I want you to do is make sure it's covered either inside the cupboard, under the sink, somewhere where it's not exposed to all the air that's been roaming around your bathroom, especially after you use the toilet. So yes, keep your toothbrush covered. Nowadays, there's special sprays to help clean your toothbrush, so you can use them as well as keeping your toothbrush covered. So that's another important part. We don't want that bacteria that's lurking in your bathroom to be ingested by you or to be scrubbed on your teeth. So let's just avoid that. Another question that I often get is, should I floss or brush first? And my advice to you is make sure you're flossing first. So using something that's going to disturb the plaque that's in between your teeth is ideal, and then you brush straight after, because we don't want to brush first and then disturb the plaque, disturb some remaining of food or something that's in between your teeth, and leave it there by not brushing straight after. So make sure that you do clean in between your teeth first, either by flossing. I'm a big fan of something called water flossing, and it has no chemicals. It's just water that's used under pressure. I really recommend that to my patients. It's very, very efficient. And then again, do it before brushing, so then we can remove and clean everything out with the toothbrush after that. When it comes to flossing or cleaning, a lot of people tell me, Maria, I just floss when I feel that food is stuck on my teeth. So I go there and remove with a little bit of floss. And to me, once I read something that I laughed, and it said, only floss the teeth that you want to keep. So that's what I'm going to leave here for you today to think about. If those are the only teeth that you want to keep, go ahead and just floss those. But my recommendation is make sure you floss all teeth. And again, create a sequence for yourself. I start from the top right and go ahead to the top left, and then I do my bottom teeth. But make sure you follow a sequence, because what we see is that people think they're flossing all their teeth, but they're jumping from the right to the left and then like, oh, I'm done. But we have a lot of missing spots that we can actually see and show our patients. So that's a very, very important point. If you're someone who replaces brushing and flossing with mouth rinsing, with just a mouthwash, stop it right now. We really want to have the basics done correctly. Flossing and brushing is the way to go. In fact, I do not recommend mouthwashes unless I'm seeing a lot of inflammation and just for a very short period of time. On top of that, it's very important to read the ingredients that are in your mouthwash. We do not want anything with alcohol in it. We've seen a spike in oral cancers and colorectal cancer because of the alcohol on the mouthwashes. So we cannot replace flossing and brushing with mouthwashing alone. So make sure you make an informed decision when you're looking after your health. And last but not least, should I use a hard, a soft, a medium bristle toothbrush? Which one to look for? Always the soft or extra soft. We don't need to scrub our teeth. We don't need to brush hard. We only need to disturb the plaque that's sitting there. And the plaque is very soft. So just by touching on fresh plaque, it just comes off straight away. So make sure you use a soft or extra soft toothbrush. You don't want to generate sensitivity by scrubbing on your teeth and removing the first layers of protection. We really want to make sure we're doing what's best for ourselves, and that means using a soft toothbrush, round motion, maintaining everything super nice and clean. And remember, follow a sequence. Let's not miss the same spots over and over again, because those are the areas that we normally see either decayed or inflamed. So we are here making this podcast for you to help you live a better and longer life. I want to bring all this information and help you make better decisions. Thank you for watching. Thank you for tuning into Mind Your Mouth. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.